All right, guys, we are live. We got Morti on the channel today. Today we are going to be discussing his procedure, hair restoration in general. Maybe get off topic for a slight minute, but it's good to have you here, Morti. How are you doing today?
I am very well, Nicholas. It's good to see you and to share this time with you.
Yeah, I'm glad you can make it again. We had a little problem with our last upload. We lost. Basically, it didn't upload into YouTube because I didn't, we lost connection, and we shot for, what, an hour and a half and came back. We're like, oh, no, we just lost everything. But I'm glad we get a chance to do it again. And this time we have a backup recorder, so if something does happen with the live feed, don't worry, we'll just upload it later.
Sounds good, Nick. I guess we can start to talk a little bit about my history with hair loss. Just for people who never heard of me, my name is Morti Zibkoff. I am a hair loss sufferer ever since I was about 19 years old. I started losing my hair around that time. Before I met Dr. Cole, I was a Norwood 5A. And for those who are not familiar with terms like that, what that basically means is that I had absolutely no hair in the front. I had very, very thin hair at the top of my head, and the back, I'd say the top third of my crown was also very thin. Basically, I kind of accepted life was going to be that way for me. Ever since I really started losing my hair at 19, I ended up at that state probably around the age of 30. That was kind of when things basically just stopped, or basically they just kind of settled. Then the beautiful thing was that I had a chance to meet Dr. Cole, and we started working together. So actually, thanks for showing those pictures, Nick. So the first picture basically shows the most recent photo that I've sent to you guys, although that picture is probably about a month or two old. For those people who are watching, I'm just going to lean my head forward so you can see what things are looking like now.
Raise your head up a little bit, Morti. Slightly out of camera. Hold on.
Forhair is run by Dr. Cole with 30 years of hair restoration
experience, looking really good.
And we offer the most cutting-edge technology available.
I'm very pleased with it.
In fact, the Forhair enterprise of company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose Forhair. We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of Forhair's video uploads. For online consultation, click on the link on the screen or in the video description.
The first week is kind of a bit of a honeymoon after the, after you get past the initial redness and trauma. The first day or two is a little rough because of the surgery and so on. But after the first week, your scabs fall off and you have a little bit of a honeymoon for probably about a week or two. And then those hairs, the majority of them fall out. And then you get a quiet period, which probably lasted for me about 6 weeks. And then it's like springtime. Your plants start growing, and they start getting shoots here and there, and things just keep getting better and better. It's been quite an experience.
Yeah, Morti. So going back to, here we go. Going back to One more time. There we are. As far as the result, you're seeing a result much faster than most patients typically would see their result come in. I mean, typically it takes about 9 months. You don't really want to see a result like you're currently having till maybe at the 6-month mark at best. You want to tell everybody about some of the treatments you did in combination with the transplant to kind of speed up everything?
Sure. So I think it's really important to understand that working with Dr. Cole is an experience in and of itself. He isn't just somebody that you're going to go to get surgery and, you know, say goodbye to. When you work with Dr. Cole, it's a commitment on his part. He treats patients like friends or almost family. He looks at the whole patient. It's not simply just the top of your head. So he gets to know you, at least for me anyway. I'm sure it's probably true for most of his patients. You know, each case is going to be dealt with in an individual fashion. For me, we wanted to take it slow, and we wanted to give all of the spectrum of treatments that Dr. Cole has to offer a chance to basically make for the best possible result. So for me, we started out with using something that Dr. Cole calls his cocktail. It's an injectable mixture of a variety of different modalities, right? So we've got at the base, there is something that Dr. Cole likes to call cytokine-rich plasma, or CRP, which is, I guess you could call it a super powered version of PRP, which is something that's become quite popular. But as most people will tell you, not everyone's PRP is the same. Dr. Cole is one of the pioneers in not just using these types of blood products, but in researching and developing new ways of using blood products to improve and grow hair. Just to give you an idea, before I met Dr. Cole, I did some PRP with another doctor, and to be honest, the result was less than significant as far as I'm concerned. So anyway, that's the first part of what the cocktail contained. The other thing that was really interesting was Dr. Cole used something called fat-derived stem cells, which isn't just a blood product, but it's a product of extracted fat from your body. The other components included something called amniotic membrane, which is a part of the amniotic sac, which is the thing that babies are wrapped in when they're born. And that also contains a lot of stem cells and other regenerative things. And in addition, exosomes were also part of that cocktail. Now, the cocktail is typically going to be different for each patient. And that was what Dr. Cole used on me. We did that about a year before I had the procedure to see if we could get some improvement. And I think we did get some improvement. It was significant, but it wasn't sufficient. Then about 5-6 weeks before the actual procedure, we did another fat graft, which is basically, again, fat-derived stem cell treatment. And then finally, during the actual procedure, there was more PRP used, and there was also something called CRF, which is going to be the fibrin. It's a kind of clotted PRP treatment, and that was used to aid in the healing of the donor area and also in the recipient to speed up the healing. And I think that all of these treatments combined yielded a really quick result. You know, the hair is growing in, and it is growing in quickly. The other thing that I'm also hoping is that we're going to have a longer growth phase. So we're going to see even more hairs get thicker, and that's going to last months going forward. At least that's the hope. And yeah, I mean, I think that about covers it.
Yeah, Morty, I want to show people some of the studies we've been doing on the PRP kits. So if we look at this right here, this chart, over here we basically have an increase in density. The follicular unit density becomes greater, as well as the hair density of a 50% skyrocket at 6 months. What's important to note about the CRP is typically it lasts about 9 months to 12. It begins to drop off at 9 months. While regular PRP, the Regen, which is the leading kit, if it's a good doctor, they're probably using that. You'll notice there's actually a drop in density And the reason for that is at the 3-month mark, it's basically pushing everything to anagen, so you're experiencing loss. And you need to come back in and do a follow-up treatment at 6 months, or at the 3-month mark, actually. Or you're basically just pushing everything into anagen and not getting a significant increase in density. So all that hair that's in the telogen face is shedding. And once it sheds, you got to turn it back on, right? And it's just not lasting long enough to turn it back on. Let's take a peek at this hair density as far as what happens when you do a CRP injection. So this is a little before photo, initial treatment, and here's after about 6 months post-op, or this is actually 9 month. So at 6 months, you should see this result. It's going to maintain up until 9 months, and then start resorting back to this by 1 year.
Interesting. Okay, so that's interesting. So those red bars were the competition, and they clearly went down even from initial to the 6 months. So it almost seems like not only is the blue bar, which is the CRP product, superior in terms of gaining density, but it almost seems not worth the effort to get the red one, because I didn't see any improvement. If anything, you saw more loss, at least according to that graphic. Am I reading it right?
Well, if you're looking at this, I mean, at 6 months, at 3 months, that treatment's no longer effective. Okay, you've basically just shed a bunch of hair. At 6 months, at 3, you need to come back in for another injection to start getting the benefit. Once those things are in anagen, keep them in anagen. Basically, at this chart, we pushed everything in. Everything was pushed into anagen, but there was nothing to keep the results going. That's why you got to keep going with it. While this treatment's an annual treatment versus every quarter.
Interesting. Okay. Well, thanks for that.
Yeah, I hope that made sense. Let's see what else we got.
That's right.
Hey, Morty, I want to pull up a picture of your beard, man. Let's
go ahead.
This beard result. Let me pull up a better one on photos. But how's your beard healed so far?
I can just show you what that looks like. Can you see that?
Yeah. Well, what about the far right side? Here, let me show everybody what we got going. Oh, wrong enter.
Just move this out of the way.
Let me zoom you in, make you primary focus. It's looking pretty good, man.
Yeah. Well, I mean, that's the beautiful thing. The beard was interesting. We didn't do too much with the beard because see, there you go. See, there was a fair amount of extraction there, but not that you'd notice. You really wouldn't notice it. And the other thing about it is it's actually even more interesting. Go back to that picture. You can kind of see something. So you could see also the back of the donor area, right? So you can see there's a little bit of redness where the extractions were, but you can even see the extractions, just how small they are. In the beard, the extractions were a little bit bigger, but they healed really quickly. And we're talking about this area here. I mean, I guess you could say that it's a little more bare, but whenever I shave, I usually shave below the chin line anyway, if I want to get a beard. So pulling from that area alone wasn't really a big deal. Matter of fact, I was kind of saddened because I was kind of hoping we could do the whole bit, but I made the mistake of not shaving at the right time. So we were only able to get a little bit. We were able to get it over here because I hadn't done a good job of shaving that spot.
So tell me, did you have a quick growing beard or slow growing beard?
Sorry?
You probably had a slow growing beard, so we couldn't see it. So you shaved, 24 hours prior?
Something like that, yeah.
Yeah, we should go for the 48. Yeah, man, but that's another 1,500. You'll notice when you're doing that procedure, you probably had another 1,500, 2,000 down there. But when you're doing that procedure, you're only able to take from one location at a time. It's not like you can create extraction sites in the donor area of your scalp and then also work the beard. So it really adds a lot of time to the procedure. So if you're talking about doing 3, how many scalp grafts do you think you had, Morty?
I think we had about 3,800, 3,900 scalp grafts is what it worked out to be at the end of the day.
3,800, 3,900, and we got some beard in. I mean, typically we'd want to do that for like 2 days. How long?
And that's what we did.
In that chair.
Yeah, so it did break up over 2 days, or maybe it was more like a day and a half because the first day was a short day. I think we went from 9 to 2 p.m., something like that. And that we did about 2,600 scalp grafts on the first day. And then the second day, we did the remainder of the scalp grafts and the beard graft.
Wow, they blew through that procedure that quick, 3-4 hours. That's pretty quick. Or no, first day was that come out to?
Well, I mean, that's the beautiful thing about working with Dr. Cole is that you're not just getting Dr. Cole, which is, I mean, getting Dr. Cole is a score right there, but you're also getting his team. And his team, they're really efficient, bright people. They're like a well-oiled machine. You got Dr. Cole doing he's doing the I guess you could call them creating the surgical. He's doing the incisions to pull out the hairs. The hairs are then extracted by a technician. Not the hairs, but the follicular units extracted by the technicians. They're put under a microscope. They're classified in terms of whether they're 1, 2, 3, or 4 or 5 hair grafts. They're also classified based on whether there's telogen hairs or not. And then once they're classified, they are then put into those different categories. And while that's going on, Dr. Cole is then also making the receiving sites, they're not called receiving sites, the recipient sites. Thank you. As soon as those are made, then the technicians are coming back around with those grafts, and they're placing them in those recipient sites. Great. And Dr. Cole he's there the whole time, so he's going ahead and he's reviewing the placement to make sure that they're all placed at the right angle and with the right distribution. I know for me, I remember there was at least one conversation where hairs were moved from lower at the edge of the hairline to further back, depending on the number of hairs that were present. And just making sure that the overall aesthetic was good. So yeah, I mean, you've got a whole team, and that's one of the reasons why so much can be done. And he's been doing this for years. I mean, I remember when John and I had that last conversation, he talked about how at the beginning his procedures were 500 grafts per session. Now he's comfortable with doing a 4,000 graft session. And that's pretty impressive, especially for a team of, I think it works out to about 3 or 4 people total.
Yeah, so I want to get into that a little bit. So as far as the extraction sites, he's actually doing all the extractions. His team's assisting him. Once he creates that extraction, they pull out basically going over that cylinder he's doing over the graft. They're pulling that out once he creates that.
Yep.
And then, it's all counted. It's managed. It's divided up into 2, 3, 4, 5 hair groups. You want to put the singles in the front. If you see some singles, rather than cutting those grafts and building those for the hairline, he's going to go ahead and target them. And what's nice about it is your whole donor area is divided up into 16 boxes. And you'll notice your hair over here is thinner than your hair in the very back. So they're going to take less grafts from here and a higher density from here. So you have this even distribution rather than if we were to look back at some of those photos, you'll see guys that just had hair taken from the very back and nothing over here was touched. So he kind of has that patchy appearance, especially when you start growing it out.
Well, I think that's absolutely true. The other thing is that not only that, Dr. Cole counts, right? So he will basically go ahead and he's got this giant spreadsheet that he puts together, which particular hairs came from which zone. And, if he's got some sort of target extraction density, like for me, his target was, I think 20% is the way it worked out. So he left 80% of the hair there and still was able to extract as much for the target area that he was going to cover. So he does the math to decide A, how much area he has to cover, B, how many hairs he has to extract, and he's able to figure out, based on that, where he's going to draw out that hairline.
As far as the donor, did you so what are you 4 months post-op now? No,
we're going into our 5th month now.
5th month, okay. So as far as the donor goes, have you noticed it starting to fill in since the procedure?
Oh no, it's thick. I mean, let me see if I can. I'm gonna, let me get a comb just a second.
Jude, how's it going down at the docks? Well, I think we lost Jude. Yeah, he's working hard, but
all right, here we go. You ask me a question, I give you an answer. All right, here we go. Lean over.
Oh, hey, come up, Morty, a little bit. You want to have? Could you turn on some light there? It's a little dark where you're at.
Sure. Better?
Yeah, I think that'd be.
Oh, that's going to be back. That's probably going to be worse. Hang on. What if I do it like this?
Oh,
yeah, there we go. Yeah. All right. So here we go, guys. So you can see here on the back. Just going to go ahead real slow.
Come up a little bit, about 2 inches. There you go.
Okay, here we go.
Yeah.
You can feel how thick that is.
It's like nothing was done.
Yep. Pretty much.
Nice.
Yep. So I'm very pleased.
Man,
I am extremely pleased with the recipient area such as it is. And I'm very excited to see how things are going. I'm going to turn off this light now because now my face is really hot. Hang on.
I'll say I think I received photos from you about 3 weeks ago, and it's really starting to fill in too since that time frame. You know, you it's a month ago, and your results pretty much almost there.
Yeah, you can see here. You can take a quick look.
Oh, come on.
Yeah, the only area I'm less than thrilled with is probably from here, which is where grafting ended about here.
Right.
Let me turn the light on.
I'm going to pull up your photo to kind of show them where your grafts took place.
Yeah.
Here's Morti's grafts. I mean,
that's right. Yeah, so you can see. Oh no, that's day one. That's day one. That's day two. Right there you go.
A little blurry.
Yeah.
Well, those was a beer grafts placed there, right?
Yeah.
Next to some scalp. And then boom.
Yeah. So you can see right here that top edge where the density markedly changes, like the top edge of the crown right there, that where that there's that line which kind of you can see. So I'm gonna just zoom in so you can see what that area looks like now. Can you see?
Yep. Oh man, I can kind of tell the beard grafts. You see how they're a little more curly and wispy? Those are growing in pretty quick.
Mm-hmm.
Nice.
So you can see, there was some density placed behind that hard line.
Ooh.
But it wasn't nearly as high as the density in front of it.
Morti, will you show that area one more time? I did not switch images.
Okay, sure. Hang on. Actually, let me do this. Let me do it this way so you don't get that hot spot there.
Yeah. And you see where it's a little gray there at the top, everybody? Right in the center of the crown. That's a beard graft right there. So see how it's a little more wispy? That's nice.
Mm-hmm. No, like I said, I'm very pleased with it. I've had lots of good comments. I'm going to turn this light off again because it's really hot.
Yeah, take your time.
It's a hot light. It just makes my face wash out to white. But I'm very pleased with the growth so far, and I want to give it the full. I'm going to probably give it the full 9 to 12 months till we get a final result. But what I'm probably going to want to do, and this is of course going to largely depend on what the good doctor has to say, is I'm probably going to want to get a little bit more work done here, and a lot of it's going to depend on what's going to happen through this area in terms of density, because the density is good. But it's one of those. It's one of those things where, the light, in the right light, like the light here, where I don't have a whole lot of top light, it looks good. But if I've got like top backlighting, I'm like, so if there's something that can be done to thicken it up. I like the hairline where it is, though. The hairline is in a good spot in terms of height. Some people might say it's high, but you know what? Like I said, I'm 50 years old. I do not want one of those hairlines that goes like this. That's just silly.
And that's really putting your donor at risk. If you start dropping down to that 6th class, you don't want to walk around looking like Joe Biden, having to put that hairspray in all the time. Yeah, well, I get the feeling that Mr. Joe also probably doesn't do too much with respect to his DHT or his regenerative, because I don't necessarily think, because it takes a lot of discipline and a lot of regularity to do that. I mean, I have a discipline every day. I do what I'm supposed to do. I take my pills, I put my topicals in, I use my shampoo, like clockwork. And in order to be able to do this for the long run, that's what you got to do. Hair loss is not a sprint, it's a marathon, and it's a lifelong marathon. So, if you're not the type of person who can be disciplined with those things, then shave your head.
because this fight is not for the faint of heart, man.
Well, going back to him, I doubt he'd be able to remember to do it.
Yeah, just a second. I'm going to lower this shade because now the sun is coming out.
I'm going to so going back into that topical, guys, I mean, I've been on it. I was on it probably in 2019. I was using it every day, and then I left out for Oklahoma. I went out there, didn't have an address, was doing a ton of construction, jumping city to city. And, you know, by the time I returned home 18 months later, my result was pretty much regressed to worse than what it was before I had started the treatment. So it's,
yeah, you got to be serious about these things. You can't let it slide, especially at that age, because the thing is that from, and I believe this to be the case, from about 18 to about 30, that's really that area is like the danger zone. If you're going to lose your hair, that's typically when you'll really see it the most, is from that 18 to 30, because that's kind of where I lost most of my hair. And I can't say that I'm a typical case, but I suspect that I am. So under those conditions, you know, that's where you want to be. You want to make sure that you really hit it hard during those years of peak, those years of your peak testosterone DHT output in your body. Now, the other side of the coin is I probably wouldn't want to do anything really significant like oral until probably around until probably after 25 or 30. But having said that, yeah, I would, if it were me, I would have done the topical right from 1920. I would have.
More, check out this topical result. You see it? This is this before.
Wow.
Look at that.
Oh man,
his hair up there in the
well, no, but that's exactly what you want, right? You want to be in a state where you've got hair that's under attack but hasn't died off yet, right? Because once it dies, it's gone. Look at that, man. That's quite a result. Good for him, man. That's impressive.
I met him like a year before this result came in, and I was like, listen, you got to try this topical if it's bothering you. You know, he was wearing a cap to work, and he was like, I just want to be able to walk around and no one make a comment about my hair. And I said, listen, try this product. It's worked miracles on guys I've known before. And I didn't hit him up. I kind of just let it drop off. He hits me up a year later and says, dude, check this out. Thank you so much. You changed my life. I was like, all right. All right. That's awesome. I'll show you what I got going on.
Yeah, no, I mean, I don't like to use the word miracle, but it works. That's the main thing that you guys need to consider. Now, the other thing that's important is there are topicals and there are topicals. And one of the cool things that Dr. Cole does is he does this thing called a tricho test. And what the tricho test does is, remember how we were talking about some people lose their hair and some people don't, and you could trace it by your parents? Hair loss is genetic, not just whether you're going to lose or not, but how you lose and when it's going to get lost is also genetic. And what is also genetic is whether or not specific types of medical treatment are going to work or not. And the tricho test will give you a good idea about which topicals are going to work better and which medications are going to work better. So, you know, I was using a topical before Dr. Cole and I started to work together. But after we did the tricho test, we found some things different. Like one of the things we found out was that I might be a responder to latanoprost, and that was added to my topical. So I can't say for certain that my hair growth in 4 months has anything to do with the use of the new topical, but I can tell you that I started using the new topical pretty much as soon as I was able to use topicals again. And, you know, the proof is in the pudding. Things are looking pretty good up there. So
here, check out, see that guy? That's me. You kind of see those temporal points receding a little bit.
And you've seen some thinness in the mid scalp too.
Yeah, exactly.
And the crown too. Look at that.
See, so we got a better shot of the crown. Sorry, I took that from the dentist's office. But one of the things is you can definitely see it starting to go.
Oh, yes.
And if we turn back onto myself right
now. How old were you in that picture?
I was 24. So that was a year ago. You can kind of see it's all evened out, right?
You know, it's coming in, man. It's coming in nice.
I will say I've been off it for 5 days. I went down to, what's that, Isla Mirada, and I forgot my topical. I was kicking myself. I checked my bag like 10 times trying to find that thing, but
Yeah, you don't want to play around with that, man. Well, I mean, I think 5 days is not going to be like the end of the world. Yeah. So let me ask you some other questions, because there's some other modalities out there that have started to become popular. One of them is what they call in mesotherapy with DHT blockers.
Mesotherapy.
Yeah. So that's what. Yeah, that's where they inject the finasteride into the scalp, and they'll do it like once every 3 or 4 months. I wonder, because I know that Dr. Cole doesn't talk about it, but it's something that I've heard been bandied about, and I'm wondering what your thoughts are, whether Dr. Cole's looked into it, whether he thinks it's worth doing.
I'd have to do some reading on it for you first, but look, $3,200 for a session. How long is it active for?
Really? Wow, that's a lot of money. Yeah. $3,200 more than covers a year's worth of topicals, just for people who are watching.
Oh yeah, so I mean, as far as the topical goes, you're looking at shelling out 12. Let's make it 10, 650, set like $800, $900. So it's a third of the price. But if you're doing an injection, right, it depends on how long you have to go in for it too. And I don't know why you'd want to inject it. It's just increasing the influx in your blood. Yeah,
no, it would definitely go more systemic. That's for sure.
Yeah.
Thanks for clearing that up, man.
Let's take a peek at some before and after photos, see what they got.
Yeah. Hey, the other question I was going to ask you, so you're just using the topical. You didn't use any of the regenerative stuff, did you, Nick?
No, I was in a platelet study, but they were just trying to get my platelet counts when there was no injection. And
okay.
What's the neat about it is you look at it, some guys have low platelet counts. They might be on blood thinners or whatnot. So we try to get a 6 to 8 times concentration. Worst case scenario is like a 5.6. I was just looking at some studies over that. And we're actually developing a better protocol. We're getting higher platelet counts. It's constantly pushing the field. As far as how it was done, we were discussing about 10 right before I left, and unfortunately, there's a lot of drinking involved, so I think I forgot about it.
Hang on, you know what, dude? You really got to be careful, man. Yeah, look. The bottom line is you got to enjoy your life, man. But to everything there's a consequence in life. There's a price that has to be paid.
Well, I'll tell you this: I tend to stay away from it all, but. When you're down in South Florida and you're fishing, it's a must do. Fishing was slow. We caught some yellowtail one day. Went for sailfish, mahi. Not a whole lot of luck there. We saw a bite. Boats were catching them in areas where just were, but as far as the entire fleet, maybe 5 out of the 100 boats that were out there caught a sail. And then tarpon. I mean, it was only like 3-4 boats that caught a tarpon my last day. But I was in the sport fish capital of the world, and I will promise you that those slow days of fishing were way better than my best days at work.
Yeah, well, it would be nice if somebody would pay you to go fishing, right?
Oh man, it's tempting. It's tempting. I know you can make a career out of it, but I'd rather own the team than be paid to be a team member.
I get you. Cool, man. So we've talked. Let's see. We talked about topicals. We talked about CRP. I mentioned fat grafting a little bit briefly. Do you have any other cases besides mine?
Oh, dude, I have a great case. Let me pull him up. He had a combination. He was on the topical finasteride, and then he came in and did adipose stem cells combined with CRP. And basically, it's just 2 different types of growth factors. So you're gonna maximize results, right? One promotes the other. Like when we put A cell inside the topical, it prolongs those release of growth factors. So we say with the CRP alone, you're getting it up to a 9-month mark. We believe we're gonna help maintain those results a little bit longer when we inject A cell in there too. I'm pulling up this before and after. Here it is. And Dr. Cole, Regenerative Medicine, adipose stem cells at 20% CRP volume and topical finasteride result. Let's go full screen with it. Oh, actually,
we're looking at your face, bro.
Bear with me. So what I did was I disconnected one phone. I just got to get another HDMI slot.
No worries, man.
Here he is. This is
wow.
This is just topical finasteride.
So no transplant at all here.
No transplant at all. He actually later came in for a transplant. I'm not sure.
Rescue hair that you have, the less transplants actually have to be made.
Right.
And that allows you to get a lot more aggressive with respect to things like the hairline placement, the thickness, etc. So, it takes somebody like what you saw before, that guy who had a Norwood 7, and basically return him to full coverage. The only way that can happen is with some of these adjunct treatments, whether they be now, that Norwood 7, he actually had some of those regenerative treatments. It wasn't just topical, right?
He came in, he did the CRP. Adipose stem cells wasn't available at the time.
Okay.
Amniotic membrane as well.
Okay. So, and this is the thing about it, is if you're going to become a patient of Dr. Cole, understand that what you may get is going to be different than what somebody got a couple years prior, because he's pushing the envelope and moving forward, and moving the industry forward with his new approaches. So, whereas somebody say, if that guy, let's put it this way, if Mr. Norwood 7 had come in, say, 5 years ago, you probably wouldn't have even taken him at all, I would guess.
No, I told him he's not a candidate. I worked with this guy for like 3 years, and
okay.
Yeah, he asked me every question in the book, and I just tried to steer him in the right direction. I wasn't looking for like a financial gain. I thought it was a lost case. But same time, I know what this dude's going through, and how much it's affecting him, and I want to give him every tool he had available to have a chance to achieve these goals. But not everyone that's in that case should expect to see those results.
Absolutely, and it's important. Yeah. This is why it's important that you have a meeting with a doctor who's actually going to see your face. So don't go to one of these places where they're going to give you a quote on a WhatsApp or some sort of Instagram. Go see a doctor like Dr. Cole, who is going to see you, is going to run his comb through your hair, who's going to take a look at your scalp with a microscope, with a high intensity magnifier, and is going to be able to give you an actual proper exam so that he can know upfront whether or not you're going to be a candidate and what the type of results you can expect. He's very conservative. He's not going to tell you a bunch of bullshit to get you in the chair. If anything, your result is probably going to be better than what Dr. Cole sells you on.
That's true. We always undersell the procedure, if you over guarantee something, you're setting yourself up for failure. And patients always ask me, do you guarantee these results? And if you got an underlying skin disease or something of that nature, any doctor that guarantees results is lying to you. It's pretty much has a 99% success rate, but if you're that 1%, we don't have a crystal ball for that.
Well, the only thing that you can guarantee is you can guarantee best effort.
Oh yeah.
And one of the things that was really true, at least in my experience, is that everybody works hard and they work, they work professionally, and they are going to do the best possible job that they can for the effort that they're putting in. You're not dealing with somebody who's going to shuffle you off. Dr. Cole is not the type of person to go ahead and, shake a patient's hand and then go off and play around a golf. That's not who he is.
No, he's one of those guys that can do unbelievable things, very limited amount of rest, and still produce. I can't remember. I have a brother-in-law. There's a name for those type of people, but they're like a once in a generation type people. Not necessarily once in a generation, but there's very few people that can do what he does. Elon Musk be a prime example. I think that guy's sleeping very little, sleeps at the office, just work, and that's all he cares about. you know.
Now, just for those listening, Dr. Cole, I don't think Dr. Cole did Elon Musk's hair transplant, did he?
No, I can't. If I knew that, I couldn't disclose it, but I don't know who did his transplant. But it looks good. Whoever did it.
Yeah, he had a strip procedure done. That's how I know it was probably not Dr. Cole.
We can get him in for a repair.
Right? Okay, Nick. I think we've covered about all of it. Is there anything else you want to add, or?
Other than that, there was something else on my mind, but we started talking about Elon Musk. I started thinking about stocks. Hey, I bought some bank stocks from JP Morgan. That stuff's going up right now. We'll see how that carries out. What we got? As far as hair restoration field goes, I wanted to mention, did we talk about low broad? We were getting into low broad hairline.
Actually, you know what we haven't talked about is we didn't talk about the slap heard around the world.
Oh yeah, good old Will Smith, man. What's interesting about it, if you don't have hair loss, you kind of join in on the joke. It's kind of funny, dude. And you saw during that video initially when Chris Rock made that statement, Will Smith was laughing. He looks over at his wife and he's like, "Oh no." And then he decides to get involved. But what the unfortunate part about it, hair loss isn't something you can really control, right? And, if a guy loses his arm, you're not going to go up to him and say, "Hey, you cripple," or you shouldn't. You'd be very insensitive. But people have no problem targeting hair loss, even though it falls into the same concept. So it's really too bad. But the good news is it's promoting sympathy for people that are experiencing it. And I think it was more beneficial than it was negative as far as final outcome. Yeah,
I tend to agree. So since I brought it up, I know we've had a bit of a sausage festival here. Why don't we talk a little bit about some of Dr. Cole's female patients?
Well, female patients, I mean, when it comes down to females, there's so many things that can cause their hair loss. A lot of times it's thyroid. So most of the time you can treat women experiencing hair loss through medical treatment, or maybe they're on a medication that's causing them to lose their hair. I have a close personal friend here in Atlanta, and she was going through the same problem. Doctor put on her bad medication. It was actually making her sick and causing her hair to fall out. And we did some blood work on her. And once we got her off that medication, she didn't need to do a transplant or an injection. So it's just a matter of completing the hair loss test we give to women. Because if they don't do it, we can't guarantee those results. Because if they're, again, going back to if you're on a medication that's causing it, an injection is not going to reverse anything. It might help a little bit, but
gotcha.
So once those are done, we non-shaven FUE. No one wants to do a shaven head, but the nice thing is you can do like maybe a partial too, where you do a patch back there, and they tend to respond well, provided we look at everything that's going on with them and make sure they're a candidate.
Sounds good. Now, how about things like the CRP or the fat grafting? Has Dr. Cole done any of that with female patients?
Yep. We have up in New York. We have a few women patients that come in annually for those treatments.
Cool.
Some girl. I actually just had one girl. She was 19 years old, experiencing some thinning. She came in for CRP injection from some Arab country. I can't remember which one it was, but she flew all the way to U.S. just to get this injection. It's not available in Europe. Europe's not caught on to regenerative medicine, and I think ACell might be banned over there, and that they don't really research their PRP kits either. Been trying to push some Turkish doctors onto getting involved in it, but they don't want to spend the money. These kits cost more than what their day's labor does. Yeah,
and that's an interesting side note about doing things like medical tourism with respect to getting hair transplants and other types of medical procedures. One of the things that people who are in the United States who are considering doing things like going to India or going to Turkey or even going to Mexico is they have to understand that we have laws in this country which basically protect consumers of medical procedures. We have malpractice law. We have malpractice insurance that doctors have to maintain in order to be able to practice medicine. And those are the kinds of things that you're not going to be able to have. Those types of protections don't exist for you if you go out of the country for medical procedures. So God forbid something happens. And I mean, this stuff happens every day. I saw an article, somebody in Brazil, for example, he went ahead, he had a procedure done, and then he died overnight. He had, there was another story of somebody in India who basically got a procedure done, and he ended up developing a really bad, what do they call that? Flesh-eating virus, I guess flesh-eating bacteria, and then he died. Those things can happen over there. Not only that, you could have something which is less than deadly, but just as damaging. Things like you can have necrosis, where part of your scalp literally dies, and you have really no recourse, right? You've got some doctor who's half a world away. What are they going to do? They're going to treat you through WhatsApp? Is that really, God forbid, if you need to get some sort of restitution, you've got no legal recourse at all. So these are things that people really need to consider before they get on a plane and, look at that really cheap $3,000 deal that includes hotel and meals. They need to really consider that, because, it could be a fun vacation, but it'll be a vacation that can stick with you for the rest of your life. Is that what you want? I don't think so.
Well, getting into that too, though, I mean, I'll give a patient a little bit of an education as far as malpractice suits go, especially in the U.S. We've done some very some clients that are very high value in the industry as far as representing malpractice and whatnot. And as far as the field of hair restoration goes, you may spend 10, 15 grand in the U.S., and if none of the results come in and it's complete failure or the technicians do it, what you can do is report it to the medical board, and they'll come in and investigate. But let's say you want to get your money back, you can sue that doctor, but the amount of money you're going to be paying to that lawyer, you're basically going to break even on your lawsuit. So a lot of the lawyers won't even take up the case unless you're fine with just hurting the doctor and not necessarily getting any compensation for it and going through that big legal trouble. So it's
I'm not saying that you should. And again, I think you kind of spoke to the fact that there's really no guarantees with this. What I'm really referring to is that that's not even an opportunity for a foreign doctor.
Yeah, I mean, you're not, if you do it over there and it's botched, oh well. Sorry.
Yeah.
They're not going to get you an antibiotic in the U.S. You're going to have to go see someone else. And, fortunately, the medical industry here, if you saw another doctor, they'd be happy to set you up with that. I mean, if you called in and had a procedure elsewhere and said, hey, I have a real bad infection, send some photos, I'll call you in a script. Or I'll have the doctor call you in a script. But
yeah,
you're not going to be able to get the medical treatment you need here if things start taking a turn for the worst.
Yeah. So, it's something to think about if you're going to go overseas. Do not, do go in with your eyes open. Understand the risks that you're taking. There's nothing safe in this world, but you owe it to yourself to understand the risks. And the risks, overseas risks. I mean, look, you can cause medical issues just getting on a flight too soon after a surgery, for example, right? Because of the change in cabin pressure, it can cause blood vessels to burst. You can have reactions to medications that don't show up until 24, 48 hours later. So, these are the things that you need to consider when going for something like a hair transplant surgery overseas. And let's not kid ourselves. It's surgery. This is not a procedure. Okay. It's real surgery. You want a real surgeon who's a real doctor with a real team who have nurses, and all of which have their proper degrees and their proper levels of experience, decade or more. You want that.
Well, getting into it, it's not as life-threatening as heart surgery is, but as far as the scale you have to operate, how small those follicles are, you have to have a real steady hand to do it properly. Otherwise, you're getting a transection rate off the charts. You spend $6,000 to do 3,000 grafts. If he's a good doctor, he's going to get a 20% transection rate. So let's say 3,000, 600 of those grafts may not grow. 36% chance if they're good transections. So you're just throwing money in the trash. You come here to the U.S., you get it done by someone that knows what he's doing. You get everything you paid for, and you're not killing donor. If you're like in Morti's case, you need every graft you can possibly spare. And once you get on with 3, I mean, even if you go, I've seen guys, one of the patient had a procedure in the U.S., the one we had on today, Jude. He had 1,500 grafts and nothing grew. And fortunately for him, he had an above average donor area. You know, there's good and bad doctors all over the world. You just got to make sure you choose the right one, do your research, and don't jump into anything. I see it all
Absolutely.
the time, 24, 28 years old. Their hairline, unfortunately, their grafts grew in, and now they're growing straight up and down. I was telling you last show that dropped off the air. He had a procedure, and the way the growth angles were positioned, it's growing straight up, and his hair over here is going forward, and he has that cockatoo appearance. You know, when the birds stick their feathers straight up, and he hates it. He wished he was just a normal, natural-looking bald guy, and it has a greater impact on his life than had he been balding.
Yeah, you don't want to put yourself in a position where you're going to be worse off than when you started. That's for damn sure.
Yeah, and that's also where you get into mega sessions. Once you start hitting graft counts above 3,500, well, 4,500 is pretty much. Once you hit 4,500, that donor area starts becoming noticeably thinner if you have an average or below average donor. So let's say you're Norwood 4, you kind of want to chip away at it like we did with Morti. We could have gone in there and taken more beard, to be honest with you, but as far as the scalp hair, pushing that number up another 700, you might have left them with a problem later on. So that's why we ask patients to come in and break it up into two if they're having significant loss in the front and the crown. You know,
yeah, I would agree. I think it's important. I mean, like you have no idea, for example, how my donor was actually going to grow in, right? You don't.
As far as your response to A-cell, you know, if you have a low yield or one side responded better than the other, you don't want to leave the office 6 to 9 months later and looking funny.
Yeah, absolutely. So, yeah, I mean, the old saying, slow and steady wins the race. And, you know, there's a very good chance that I'll be seeing the inside of that OR once again. But I am very happy with what's been happening so far. So,
yeah, I mean, looking at your result 5 months in, you're looking pretty strong, man. Another month.
Thank you, bro.
It's gonna be. I think it's gonna be looking real good. I mean, you may want to add some density. I'd say put you in the same class as Drew. Throw a little more density in that front, really thicken it up. Take a peek at the donor.
A lot of it's going to depend on what's available, though. That's the other side of the coin.
Well, looking at what you got going on now, I mean, your donor responded really well. I mean, it doesn't look like it was over harvested. I don't see a ton of thinning. You're running your front and comb. You're wearing a short haircut, so that better exposes how much donor you have available too. You know, you grow it out to 2 inches in length. It's a lot harder to tell.
Yeah. Speaking of which, I'm probably going to give this a cut pretty soon. But yeah, I mean, let's put it this way. I'm loving the fact that I got a little bit of volume here. You know, I can actually touch it. It's, you know, just doing this, man, it sounds crazy, but like, you know, I mean, you can see just by touching the top of my head, how my smile just grows across my face. You know, I tell you something. I was diagnosed personally as somebody with chronic depression, but after I had this done, my whole outlook on life has changed. I'm feeling very grateful and very happy to be able to look myself in the mirror and see what I'm seeing. It was definitely and continues to be something that's changed my life for the better.
Yeah, tell me a little bit about the difference in confidence, man, as far as the overall impact in your life.
Well, so I'll tell you a little anecdote. When I first started losing my hair, I was in a band. I played bass guitar in a band. This was in the late '80s, and back then, hair was the thing. You know, you see the bands at the time, bands like Warrant, Poison, they all had hair down here. You know, and I've got curly wavy hair, so growing hair out for somebody like me was a multi-year endeavor. And I had gotten into this band and I was intending on growing my hair out. I could probably dig up some old pictures of what I used to look like. And, you know, I remember one day my guitar player was like, "Yo, man, you're losing your hair." I'm like, "I am?" And he's like, "Yeah, you are." He says, "If you're going to want to be in this band, you're going to have to wear a wig because your hair is never going to grow out the way that would be necessary in order to complete the look of this band." And I remember being heartbroken because I had spent a lot of time learning the music and, you know, writing music and learning the lyrics and how to sing and all these kinds of things. And I was heartbroken because I just was not going to wear a wig. I tried, like I literally tried one gig to wear one, but I started sweating underneath and it was uncomfortable. And I said, you know what, I'm just going to have to give up my dream about being a rock star. Now, lucky for me, that actually pointed me in the right direction in life. But the other side of the coin is that it's affected every aspect of my life, not just that. I mean, I remember being in bed with my girlfriend at the time and her reaching over and running her hands through the hair at the time and then lifting her hands away and having a few hairs stuck on her hands. And the look of shock on her face when she did that. And she said, I'm sorry. And I was like, nah, it's okay. It's just what happens. And we ended up breaking up not too long after that. So yeah, man, I mean, to say that hair loss affected me emotionally is an understatement. Now I was able to find a way to cope, and the way I coped was just to keep it really, really short. But once I found that there was a way to try to address it, initially, we went out with the topicals and the orals and the injectables and so on. But I almost brought little bits of hair back and forth, but they didn't do the trick, if you will. But this is a whole different ballgame, man. I'm much more confident. The only reason I still wear ball caps outside is because I haven't hit the 6-month mark. I was told by the doctor that you shouldn't expose your hair to direct sunlight for at least the first 6 months. But trust me when I tell you, once the sun goes down, that hat comes off. And I'm very comfortable with the way it looks. I am, like I said, I'm over the moon in terms of happiness, in terms of the way I look. And, the girl I'm seeing, she comes every time we see each other. She's like, "Oh, your hair got longer." I said, "Yes, it did." So, yeah, I'm a much happier person as a result.
Well, I mean, looking at it, you waited. It seems like you waited kind of a long time to get into it. What held you back and start doing research sooner and getting on some kind of preventative at a younger age?
Well, I think a lot of it was just ignorance, man. A lot of it was just not knowing. I didn't really know anything about finasteride until 2017. That was basically when I first found out about that. And I didn't even find out about that because I didn't even know anything about, anything about follicular unit transplantation. So to tell you that story, basically I had been, the only thing I knew about hair transplants was, when I first started losing my hair, I knew about Hair Club, which I was not going to do. I had seen some of the ads for Bosley, and the Bosley ads looked A, painful, and B, really expensive. And at the time, I just didn't have the wherewithal. This was when I was in my 20s. And then when the hair really started falling out, I was like, fuck it, this is done. The only thing I had promised myself was I wasn't going to do the comb over thing, and I didn't. So I kind of just left it on the back burner and didn't think much of it until 2017 when I had gotten into a job and I met this dude. His name was Mohammed, Pakistani guy. And he had a big old bald patch, but he had a halfway decent hairline. And one day I'm like walking down the hall behind him and he had a recent haircut and I saw he had a linear scar, the happy face scar in the back of his head. And I asked him, I said, dude, what's that scar in the back of your head? He said, I had a hair transplant. I said, really? And then, he told me where he had the transplant. He had it done on the hairline. And I looked at his hairline and I said, that's a transplant? The only thing I knew about transplants before then was the multi-hair graft transplants of the 1980s. There was a guy that I had seen in a diner. This is going on, like I said, in the 1980s when I was in my teens. And I'd seen this guy, he owned the diner. He had a Greek guy, very jet black, thick hair. But he had the front done and he had this plunge, exactly. And he looked like he had doll hair on the front of his head. He had these chunks of hair growing out with big spaces in between. And I said to myself, man, if it ever comes down to it, I would rather shave my head and keep it really short and just deal with being bald than having a look like that. And that was kind of when, that was as much as I knew. So the whole idea of planting individual follicular units was something I hadn't even heard of until 2017. After that, the next thing I did was I started doing the research on the internets, right? So I basically went online and I found out about the IAHRS, the International Association of Hair Transplant Surgeons. This web TV show called The Bald Truth, which goes on every Friday at 6 p.m. And I started watching those two guys, Spencer Coburn and Joe Tillman. And then through the IAHRS, I was able to find different doctors. And at first, I looked at some doctors here in New York. At the time, this was like summer 2017. And Dr. Cole, I believe, had a presence here, but he wasn't advertising it very heavily. So I went to I went to one doctor in New York, and he was the one who prescribed me the first topical that I used and put me on the oral. And then after that, I moved to South Florida and lived there for it must have been close to about 2 years. And I saw two other doctors down there, and, each of them were good. The first doctor I saw in New York, he was good. At the time, I didn't even have a frontal forelock. So he drew what amounted to a much more conservative hairline. The hairline he drew was probably somewhere about here, as opposed to where this is here. And to his credit, he was going to do, I think it was 2,700 grafts. But, I didn't have nearly as good donor or mid scalp as I do now. So, in the end, the cost and the end result didn't really please me in terms of placement. And so I just decided to give these topicals a try. Then I went to see some doctors in South Florida, two of them, in fact. One of them didn't really like his results too much, didn't really impress me. The other one, the other doctor in South Florida I saw, this was late in 2019, had some good results and his price was right. But unfortunately for timing, I had to move back for a personal reason back to New York. And now that brings us to January 2020, when I saw Dr. Cole's advertising in New York City. And at that point, I went in for a consult, and it was a horse of a different color. Here's a guy who, didn't need to put on airs, wasn't trying to do the hard sell, wasn't really interested in convincing me how I could do the procedure and nobody else would know. These are the kinds of arguments that I got from some of the other doctors. Didn't want me to sign a whole bunch of paperwork that, protected him from from defamation. Didn't have any issues of, legal entanglements, which one of the other doctors that I had seen had. So we had a good, honest, friendly person who happened to be a hair transplant surgeon, and somebody who was willing to basically work with me, talk with me, take the time, and become more than just my doctor, but my personal friend. And that's why I ended up with Dr. Cole.
Yeah, we had some good times in New York, didn't we? Except for the
we did.
COVID card thing. It felt like
yeah. You got to come up, man, because things are much better now. They're not checking for anything now, so you can just come on up.
Just when I get a card.
You don't need it anymore. They don't check anymore.
Yeah, that's great news. I honestly.
Well, it's about time
for me. But what was that comedy show we were supposed to go see?
Oh yeah, we were supposed to go see a friend of mine, my good friend. And Andrew Goldstein, otherwise known as what the hell is he called now? I can't remember what his name is. His name is Andrew Goldstein, but he's a comedian. Why can't I remember his name now? He does this whole bit where he puts on a leather jacket. Anyway, a top name comedian who probably could use Dr. Cole's help at this point in his life. But we couldn't get in there because of the COVID restrictions. But yeah, you should definitely come up and hang, because there's a lot going on, man. There's a lot of bands that I go out to see. Yeah, man, it would be good for you to come on up. That's for sure.
I plan on it. I plan on it. You just hang tight. I've been traveling a little much lately, but I feel like New York's in the cards pretty soon.
Excellent.
Man, what a great show we've had so far. All right, guys, I want to thank you for joining us and give a shout out to our sponsors, Forhair Clinic, Cole Instruments, Hair Cycle, FUE Magazine, FUE Europe. If you have any questions, want to talk to us next show, give us a call in. I will put that number on the board, 240-393-2000. Thank you, ladies and gentlemen, and you take care and have a great one.
Forhair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the Forhair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose Forhair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of Forhair's video uploads. For online consultation, click on the link on the screen or in the video description.